Hello everyone, our topic for today is about breastfeeding. Breastfeeding is best for your baby and it's good for your health.
What are the benefits of breastfeeding for your baby?
Breast breast milk provides the ideal nutrition for infants. It has a nearly perfect mix of vitamins, protein and fat, everything your baby needs to grow. And it's all provided in a form more easily digested than infant formula. Breast milk contains antibodies that help your baby fight off viruses and bacteria. And also breastfeeding lowers your baby's risk of having asthma or allergies. Plus, babies who are breastfed exclusively for the first 6 months without any formula have fewer ear infections, respiratory illnesses, and bouts of diarrhea. They also have fewer hospitalizations and trips to the doctor.
Are there breastfeeding benefits for the mother?
Yes, breastfeeding burns extra calories, so it can help you lose pregnancy weight faster. It releases the hormone oxytocin, which helps your uterus return to its pre-pregnancy size and may reduce uterine bleeding after birth. Breastfeeding also lowers your risk of breast and ovarian cancer, and it may lower your risk of osteoporosis too. And there are the benefits of breastfeeding. Number one, it helps protect the baby against, for example, diarrhea, cough, colds, malnutrition, and other common illnesses. Number two, there is no need to prepare breast milk. Number three, it is always available at no cost. Number four, it helps babies grow up with close bond to their mother. Number five, it is easy to digest. And number six, it is clean and has the right temperature. 7. Meets all the food and fluid requirement of an infant for the next 6 months of life. And also, the benefits to the mother: if the baby is placed to the breast immediately after delivery, the sucking helps the uterus to contract, thereby reducing bleeding.
What's the best position for breastfeeding?
Wow, the best position for you is the one where you and your baby are both comfortable and relaxed. And you don't have to strain to hold the position or keep nursing. Here are some common positions for breastfeeding your baby. Number one, or first, cradle position. Rest the side of your baby's head in the crook of your elbow with his whole body facing you. Position your baby's belly against your body so he feels fully supported. Your other free arm can wrap around to support your baby's head and neck, or reach through your baby's legs to support the lower back. Next, football position. Line your baby's back along your forearm to hold your baby like a football, supporting his head and neck in your palm. This works best with newborns and small babies. It's also a good position if you are recovering from a cesarean birth and need to protect your belly from the pressure or weight of your baby. Sidelining position. Next, then this position is great for night feedings in bed. Side lying also works well if you are recovering from an episiotomy, an incision to widen the vaginal opening during delivery. Use pillows under your head to get comfortable. Then, snuggle close to your baby and your free hand to lift your breast and nipple into your baby's mouth. Once your baby is correctly latched on, support your baby's head and neck with your free hand so there's no twisting or straining to keep nursing.
So what are the benefits of breastfed babies?
Okay, number one, the benefits of breastfeed babies: get sick less and have a lower risk of allergies. Number two, have a lower risk of obesity and types 1 and 2 diabetes. Number three, have a lower incidence of sudden infant death syndrome. And number four, have a reduced risk for ear infections and gastroenteritis. Number five, are on the path of optimal brain development. Number six, get nutrients that help strengthen and develop their immature immune system in a way no other substance can. Next, number seven, respond better to immunizations against polio, tetanus, diphtheria, and Haemophilus influenza. Number eight, have optimal oral development because of their jaw movements, and nutrients in breast milk decrease the risk of tooth decay. And number nine, are protected against respiratory infections, including those caused by rotaviruses. And number 10, are less likely to be hospitalized with pneumonia or bronchiolitis and have decreased risk of lower respiratory tract infections. And last, number 11, have been associated with a slightly enhanced performance on cognitive development tests. Sometimes formula feeding can save lives, but very rarely babies are born unable to tolerate milk of any kind, and these babies must have an infant formula that is hypoallergenic, dairy-free, or lactose-free. A wide selection of specialist baby formulas now on the market includes soy formula, hydrolyzed formula, lactose-free formula, and hypoallergenic formula. But your baby may need formula if you have a health problem that won't allow you to breastfeed and you do not have access to donor breast milk. So talk to your doctor before feeding your baby anything besides your breast milk. To learn more, visit the Breastfeeding a Baby with a Health Problem section. To learn more about donor milk banks, visit the Breastfeeding and Special Situations sections. And these are the risks. Also, health risks to newborns are minimized by quality care during pregnancy, self-delivery by a skilled birth attendant, and strong neonatal care.
Thank you. So with this, is there any immediate concerns of breastfeeding?
Yes, breathing temperature regulation, and other is cord stump care, awareness of possible health problems, early initiations of breastfeeding, and also signs of adequate breast milk, frequent bowel movements with diaper usage, baby's urine is pale in color, mother can hear the baby swallowing the milk, the baby is calm and relaxed after feeding, and the baby is gaining weight. Mother's breast feels softer after feeding, and also have a barriers to let down reflex. Emotions as embarrassment, anger, irritation, fear, or resentment. Other is fatigue, and also poor suckling from improper positioning, and also not enough baby is actively nursing. Another is stress and negative remarks from relatives or friends. Other is fear of pain in your breasts or uterus, and breast engorgement in the first few days. Not enough sleep, and inadequate fluid intake, making the decision to breastfeed, that's the idea.
And lastly, what is your final message?
The final message is to all mothers, breastfeeding is best for your baby and it's good for your health.
Kabukoy.
Stop. Saan mo ipag-stop?
Pwede mo siguro ito tapos i-insert lang to?
Oo. Eh, putlo naman na. Ila naman ako nun.
Bukuya wala na ako. Ano ko na akong dede mo?